Thank you, Dave. And Dr. Natasha Iyer is an MD, and she runs the wellness clinic at Kronos Apollo. In her practice, she focuses on cancer prevention with her patients. So she's here today to talk about the steps that you can take in terms of how you can minimize your odds at developing the disease. Thanks for being here today.
Thank you, Jill.
Okay, so let's start with the basics here. What is a cancer cell?
A cancer cell has damaged DNA. So every day our bodies are repairing and renewing cells by the billions. And during this process of cell renewal, we can damage a part of the DNA, and that will become a cancer cell if we don't stop that process from multiplying.
Okay, so we actually have a picture here of a cancerous cell. And if you can actually describe to us what we're seeing here on the
So this is an abnormal cell with all the processes and growths that make it abnormal. So a normal cell would look quite healthy, and this kind of looks like a monster. That cell will divide, and multiple cells of this will now form a tumor. So a single cancer cell can exist in your body, but when it starts to divide and grow into a mass, that's when it becomes dangerous to you.
Do we all have cancerous cells?
We can all have cancer cells at any one point in our body because we have billions of cells multiplying. Good, healthy immunity and cell function would be the way that we protect ourselves from these cancer cells, so they stop multiplying in the body.
Okay, so we're going to talk about some ways that you can minimize your risk, but let's talk about the process first, and you brought a graph here to explain that. Okay. And let's take a look at this picture here.
So on the, a cancer cell has the damaged DNA, and we would block it off at this process.
Okay.
Once it starts to multiply here,
at the bottom of the screen.
At the bottom of the screen is where we can change things. So we would block it at the first blue cell with healthy diet, healthy lifestyle, and those are all your modifiable risks. Genetics and other processes would influence the process to the lower group of cells, which is your cancer.
Okay, so why would we see an increase in cancer?
An increase in cancer because of our diet, lifestyle, environment of modern living. These factors are things like obesity, nutritional components and toxins and pollutants, chemicals that we ingest that affect the way we can now block this process of cell division and protecting ourselves from an abnormal cancer cell.
But there is a genetic component as well, is there not?
There is a genetic component, and that's what we call a non-modifiable risk factor. The modifiable risk factors like obesity are very much things that we can do, and about 70% of our cancer risk can be reduced by taking care of these modifiable risk factors.
Okay, so you mentioned some of them, including diet and exercise. So if I watch my diet and I'm an active person, I can actually prevent my chances of getting cancer.
It's not preventing, but reducing your risk, and it's not as simple as that. The link between obesity, for example, indirectly is linked to hormones. So estrogen and progesterone, insulin, these are all hormones in our body that can, when they're out of balance, allow cancer cells to overgrow. And our goal is to do things in our lifestyle, like eating a healthy, nutritious diet, to give our body what it needs to stop that process.
And what are some of the other modifiers other than diet and exercise?
Stress is actually coming into vogue now, very, very important, because the stress hormones can affect our immunity, and our immunity is what protects us from any invader to the body. So be it a virus, be it some kind of illness, or a cancer cell, they're all treated the same in our body.
Oh, is that right? So stress is really something that you should watch then?
That's right.
Okay, and what about research in terms of breast cancer and high estrogen?
High estrogen has been linked to breast cancer for a very long time. What we're now finding out since the 1990s is that progesterone, low progesterone, is a direct link to breast cancer, and this is becoming a problem in our modern society based on a number of, again, environmental and dietary factors. When we look at low progesterone, it gives us things like PMS, infertility, but it can also be a very direct correlation. In 2001, Canadian researchers found a link between the hormone insulin and breast cancer, and this can actually be traced back to substantiating this link between obesity, an imbalance between the women's hormones, estrogen and progesterone, and breast cancer. So a very, very important identifiable factor that we can actually manipulate and change now exists between obesity, estrogen, progesterone, and insulin.
Really? So weight actually affects the level of estrogen?
Huge. Yes, it does.
Which is a controllable factor.
That's right. So at Kronos Apollo, what we would do is we would help you lose weight based on your identified risks and use your hormone balance to guide this weight loss safely and effectively so that you're not only getting healthier for every other risk for heart disease, but we're now looking at cancer.
Okay, so you actually would see patients where you would be turning those factors around in terms of the diet and the exercise.
So our new program at the clinic, which is devoted to helping people identify their risks and modify it, is where we would screen you for all these now very important modifiable risk factors.
Okay, and there's a website if people want more information, chronosapollo.com. Dr. Natasha Iyer is a MD at that clinic there, and you can log on to find out more information about that. Thank you so much. Really interesting information this morning. Thanks a lot for being here. And Andy is standing by with more on the forecast. Andy?